Screening for prostate cancer is variable. There are some recommendations to start screening for prostate cancer at the age of 40, typically for African American males, for males who have a strong history of prostate cancer in their family. The current recommendation would be that an initial screening would take place at the age of 40. If that screening was normal, a repeat at 45, and if that is normal, then going on to age 50. The general population recommendation for screening would essentially be to start at the age of 50. That's if there are no risk factors, no high risk of family history of prostate cancer, then we would start at age 50. So African American males tend to have a higher risk for prostate cancer. There is certainly an increased risk for prostate cancer in families where there is a primary relative being a father or a brother. So prostate cancer is the most common form of cancer in men. It's the most commonly diagnosed cancer in men, in particular when we start talking about men over the age of 50. The detection rate for prostate cancer has been relatively stable over the last several decades. With prostate cancer screening traditionally over about the last 20 years, prostate cancer screening has involved a blood test called the PSA. The PSA stands for prostate-specific antigen. It's a protein that's produced by the prostate gland, makes it into the bloodstream. If the PSA test is elevated, it tends to be an indication that you're at a higher risk for having prostate cancer. It does not actually diagnose prostate cancer. It's a screening test to tell us which patients may or may not have a higher risk for having prostate cancer. There is another screening, a portion of the screening, which is the examination of the prostate. The examination of the prostate before the advent of PSA testing was the most common way to diagnose prostate cancer. Typically when prostate cancer is diagnosed by being able to examine the prostate digitally, the prostate cancer at that point in time is typically a little bit larger if it's large enough to be felt. So in the PSA era, the primary mode of detecting prostate cancer has been an elevated PSA test. One of the things I talk to patients about routinely is that PSA testing is only one tool that we use, and prostate cancer is only one of the disease processes that can happen in the prostate. It's actually much more common for men to have benign disease of the prostate than it is cancerous disease of the prostate, and the benign disease of the prostate typically will have symptoms, whereas prostate cancer typically does not have very many symptoms. Benign disease of the prostate typically does. Enlarged prostate oftentimes is just a benign process where the prostate enlarges in size and then it constricts the flow of urine and it causes those symptoms of getting up at night to urinate, having a slow stream, feeling like it takes too long for the bladder to empty. That actually is probably the majority of patients that we see with prostate-related issues. It's to manage the more benign disease of the prostate.